I'm ready.
Alright, so we have to wrap a spay pack and we have to make sure that we have all of our materials. So I have prepped a cold sterile tray with a drape folded inside to create a barrier between the two metals of the tray and the tools. Once this is ready, I can start to stack my tools inside. So sticking that chemical indicator strip on the bottom deep within the pack, and my other flat item, which is my surgical blade. I can also set inside my Snook ovariohysterectomy hook, my scalpel handle, and my brown Adson thumb forceps. I might put those over there so I have a good open space for my 2 stacks of tools. And then we're gonna start stacking our tools. So starting with the largest on the bottom and making sure that they are unlocked. We're gonna stack likes to likes, so all of our curved together before our straights. And we're gonna start with our Rochester Carmel hemostatic forceps on the bottom. Next up, unlocking the Kelly hemostatic forceps. We know that they're Kelly's because they're only ridged halfway up the tool. Making sure that they are stacked nicely. Next up are our Cryo hemostats. They are bridged all the way up, but they are larger than our mosquito forceps.
So the crow's the bigger one.
Yes.
Mosquito's smaller one.
Okay. Lastly, for this stack are going to be the mosquito forceps. We know that they're mosquitoes because they have ridges all the way up and they are super tiny. The smallest of the tools inside of the pack. Make sure they're like stacked nice. So we have our first stack. We're gonna set down over here. Make sure that they're stacked nicely.
Does it matter, like, if they're in a corner or if they're in the middle?
Not necessarily.
Okay.
It just usually helps if they're a little bit centered so that you have some space in between the walls.
Oh, okay.
Our next stack we're going to do is going to start out with our needle holders, whichever ones your doctor prefers. So either the Mayo Hagar or the Olson Hagar needle holders or needle drivers.
So this one's the Mayo Hagar?
Correct. No cutting aspect.
And then the cutting aspect, this one, right?
We don't have them in this pack.
Oh.
So only one type of needle driver is typically in a pack. If they were to choose this one, you have to make sure you have general scissors and suture scissors. If you have the Olson Hagar needle holder or needle driver that has a cutting attachment with it, the doctor might not want an extra pair of scissors.
Okay.
So starting with that needle driver on the bottom, we can next stack our Alice tissue forceps. Sorry.
It's okay.
Then we have our regular Mayo dissecting scissors and our suture removal scissors with that curved edge, making sure everything is unlocked and open. I'm gonna flip those around and place them opposite my first stack so I have a good amount of space between everything. And next in the pack is going to be my 2 stacks of gauze. So me and the doctor should both be aware of how much gauze is within the pack. So I should count beforehand and the doctor should count after the surgery. So 1, 2, 3, 4, 5 in my first stack. Stack them nicely. 1, 2, 3.
Would you prefer
5.
to count like that or to like place them on
It's better to take them fully apart because what you can do potentially is be counting one as two. So unless you're really comfortable counting the gauze, I would separate them all the way so you can be sure of how many there are.
Okay.
I'm gonna try to keep my tools arranged and set my gauze on top. And the next thing is going to be the patient drape. So this should be accordioned. This one is not folded very nicely. It should be accordioned back and forth, both long ways and sideways. We can make a separate video on this if you would like.
Okay.
Placed on top of those gauze with those tabs facing the top.
Oh, okay.
The next step is going to be our accordioned huck towels. So folded accordion long ways and sideways, and then ending with a folded back pull tab on top.
Okay.
So one on one side, one on the other.
And
Their orientation doesn't matter too much as long as you have an opening space on one side to tuck in your last tool, which is your back house towel clamps.
Okay.
So 3 should be facing one way, the 4th one should be looped through the first 3, all of them unlocked and slid into the huck towel. And then you're ready to start wrapping your pack. So I really try to compress everything to get my pack as tight as possible. And then in a clinic, this would not be done on a floor. This should always be done on a clean, dry, stable surface. So I'm going to start with the wrap that's closest to myself, hold down and wrap my first layer, and give myself a courtesy tab. And then I'm gonna start on the sides. So I just fold down a little bit so that I have a clean line over here for when I wrap to the side. Pull the pack back a little bit and make myself a courtesy tab. Same thing on this other side. Just give yourself a little crease right there. Fold the side. Courtesy tab. And then I always flip around for this step. For me, this is easier if it's facing me. Again, not tucking, but just creating a crease for yourself before folding that final tab and tucking underneath the 2 side flaps that you have just created. And leaving myself a courtesy tab, turning it back around to make sure that the tabs on the internal wrap and the external wrap, the final tab is ending up on the same side.
Okay.
So then wrapping exactly the same for your second layer. First fold, courtesy tab. Courtesy tab. Again, I flip towards myself, fold down just a little bit, pull my final flap over, and try to make your folds pretty so that it sits pretty flat. And then your final tab. Once your pack is packed, you're going to follow up with creating a label and placing a secondary sterilization indication tape. So your first label should be general masking tape that goes from the sides, completely covers the top, and has a pull tab on one side that you folded the tape over on itself. That first label should include, in whatever order, the date that the pack was wrapped on, the initials of the person who packed it, and the type of pack that it is, So for this one, it would be the 21st of November, 2024, wrapped by SFH for Miss Hamilton's initials, and a spay pack. And then I'm going to put a small piece of sterile indication tape either above or below that label, and then my pack should be complete, and you should be able to shake your pack every which way, toss it up. It should not unfold. The tools should not be moving around, smacking the sides, and then we can unwrap it real quick. So when the unwrapping process is happening, like I said, there should be that label here across the top and the chemical indication strip. So if I were to begin, I would have scrubbed my hands with a sterile scrub and probably applied sterile gloves and made sure that I had a clean, dry, stable surface to unwrap my pack on. I'm going to place a hand on the pack while I remove the first tape and attach it to my body. Remove the chemical indication tape and attach it to my body, and then I may begin. So throughout the whole skill, your hand should stay above your waist and above the table. Your hair should be put back. Once you have those gloves on, you shouldn't be touching anything. So at this point, I would begin. I'm going to grab the first tab with my fingers, and whichever arm you grab with will tell you which direction to go for this first tab. So since I'm starting with my right hand, I'm going to move all the way to my right around this table with my arm fully extended out. I'm going to let the tab fall once I'm confident in its arrangement and come back to the side or the back. And then your two side tabs. The pointing direction of your side tab will tell you which hand to use. So pointing to the left, I'm going to use my left hand to grab that pull tab, step to the side, and lower my drape. Same thing for the right. And I can fix that later if this happens.
Okay.
My last one, I'm going to pick up. I'm going to look behind me, take a step back, and allow that last tab to fall. If this was in real life, I would go ahead and fix this and be done. Someone else would come back and unwrap that second layer. So for my last step, I would go underneath the drape, grasp the drape, and fix it without touching the inner layer. And now that I've gone below my waist and under the table, I can no longer touch the sterile surface. I should back away without ever turning my back on the sterile surface. For check's sake, I'm going to go ahead and open this. So the inner layer should only be opened by a fully scrubbed in, fully sterile tech. Same process. You're going to start with your hands up, obviously fully scrubbed in. That first layer all the way around the sterile field, never crossing where it is unnecessary. Dropping that first layer. Right side to the right. Left side to the left. And my last one, check behind you, take a step back and drop. And then the surgeon would be able to access all the tools. So let's see what it looks like underneath everything real quick. Shouldn't have moved around too much. So my stack did fall over a little bit here. I could have probably made it a little bit tighter, but for the most part, your stack should be fairly in the same place that you started in.
Okay. When you're putting the stuff in, would you fold these, or would they be pre-folded?
You will have to fold everything. Yeah.
Okay. So it'll be all laid out.
We can do another video if you want, and I'll fold this one for you on the table.
Yeah. I would like that.